Hey, in this video, I'm going to be explaining how Hashimoto's affects a type of testing called vestibular function testing that you would get if you had any type of chronic vertigo. These are tests like Optokinetic Nystagmus, a Caloric, a Rotary chair kind of a test. So if you have chronic vertigo or if you have Hashimoto's, this one's for you. So I've got a lot of videos that talk about chronic vertigo and chronic BPPV. I have a lot of video on Hashimoto's because I've seen lots and lots of these patients over the last 20 years. And I've always known there's a connection between Hashimoto's and vestibular dysfunction. Now, there's been more and more research over the last several years trying to look at specifically what is the relationship between Hashimoto's and different aspects of vestibular function. So vestibular function testing is kind of a standard way that ENTs and neurologists and neuro-otologists try to assess your peripheral vestibular system, right? So your peripheral vestibular system's got your semicircular canals, your cochlea, your vestibule, and these tests are trying to determine, is that working correctly? So let me just run through these tests very quickly. So there's a test called a caloric test, and that's where you use either warm or cold air or water, I use air in my practice, to stimulate the vestibular system to see if there's what we call a directional preponderance, because there really shouldn't be a directional preponderance. But if you find one, that means one side is probably weak or you're not able to excite one side. The other test that you can do is what we call a Dix-Hallpike test, and that's a test for BPPV, benign paroxysmal positional vertigo. And usually do that with infrared goggles on, and that's where the person, you get your head rotated and you tilt back, and we're looking for nystagmus that has certain characteristics. The other test you can do is what's called a rotary chair test, and that's where a person is rotated at a constant velocity clockwise and counterclockwise, and the involuntary movement of the eyes, called nystagmus, is recorded. And then there's what we call, some people call it different things, it's called a swing chair test, and that's basically just looking at something called visual vestibular ocular reflex, otherwise known by me and a lot of my counterparts, optokinetic nystagmus, or OKN or OPK. Also with that kind of a chair test, you can look at vestibular ocular reflex, and what that is when, like if I rotate my head like this, if I rotate my head left and right, and I'm trying to look at something, if I rotate my head to the right 1 inch, my eyes should move the opposite direction 1 inch, right? So input is an inch, output's an inch, 1/1, that equals a gain, what we call that. That's a gain of 1. Now with the visual vestibular ocular reflex, that's where they usually run a pattern in front of your eyes like stripes or circles, and your eyes want to grab a target and then look at the next one, grab a target and look at the next one. And that eye movement's called optokinetic nystagmus. You can get that like if you're riding in your car and you're looking out the window and you're seeing telephone poles go by, that's optokinetic nystagmus. All right, so we talked about those. Now the other thing you can do is what's called cervico-ocular reflex, and you do that with your head still and then your trunk is turned. I can't do it in a chair, but that's looking to see how your cervical muscles are influencing your eye movements. So those are the different aspects that some people from Poland did, about I think in 2022, and they were looking at the relationship between chronic vertigo of different kinds and Hashimoto. So they had 28 female patients that had chronic vertigo and Hashimoto's. Now, some of these chronic vertigo patients, what they found out is that the vertigo was being caused by BPPV, and that's the most common cause of peripheral vertigo. Some of them had a vertigo caused by Meniere's disease, and I've got a lot of videos on Meniere's disease. And some of them had their vertigo caused by something called vestibular neuronitis, which I don't have a lot of videos on yet, but I'll put up a few about it. Now, they found out that that was the cause of their vertigo based on their history and based on those tests I just showed you. Now, every one of those patients, though, had elevated thyroid peroxidase antibodies and elevated thyroglobulin antibodies. So quick detour, Hashimoto's is an autoimmune thyroid condition. It's the most common organ-specific autoimmune disease. It's the #1 cause of hypothyroidism, and I have 100,000 videos on different aspects of Hashimoto's because I've treated so many patients with it over the years. So they looked at these people and they said, okay, what is the relationship between these aspects of vestibular testing and Hashimoto? So here's what they found. So they did all those tests I talked about, the Dix-Hallpike and the cervico-ocular and the vestibular ocular and the OPK or visual vestibular ocular reflex and the rotatory chair test. And what they found is that out of the 28 patients, and that's not a lot, I might add. Now, if they had 100 patients or 200 patients, we might find different results. But out of those 28 patients, 5 of them had an abnormal directional preponderance during that caloric test. And by the way, caloric tests are not any fun. I just have to tell you, having cold air put in your ear that gives you like nystagmus and probably dizziness, not a lot of fun, but it's a necessary test. Now, on the visual vestibular ocular reflex, or the OPK test, they found that those patients, about 16 patients, had a low response, meaning the gain was low. Now, what that means is, for a given amount of visual stimulation, their eyes were not responding to it the way that it should. Now, we have to ask ourselves, does that even matter? Well, yeah, it matters, because what happens is those reflexes are designed to keep your eyes on a target, something of interest. And if you can't keep your eyes on that, then the image is going to blur on your retina, even for just a little bit of a second. And when that happens, that can trigger momentary disequilibrium and instability. And for some people, it can actually trigger bigger reflexes and they fall. But it definitely contributes to dizziness and instability and disequilibrium. So they found that the gain of that response was low. Now, the other thing that they found, and it's going to be, I'm going to try to explain this, is that the VOR, remember this one, like when I'm just turning my head, the VOR gain increased with the level of TPO antibodies. Now, the authors say, well, this is not a big deal because you want a high gain with that test, but I'm going to disagree with them on that, because if your gain is high, what that means is if I turn my head an inch, my eyes are going to go farther than that. Meaning, if I'm trying to look at the camera right now, right, and I turn my eyes are going to shoot past it. And again, the image is not going to stay on my retina. It's going to blur. And when it blurs, that's going to trigger that momentary, that disequilibrium, maybe even dizziness. And some people can cause them to lose their balance. So the authors, they kind of say it's no big deal, but I'm telling you it is a big deal. So we've known for a long time that Hashimoto's has an effect on the vestibular system. What they're saying is, with the 28 people they looked here that had these different conditions, what happens is about 16 of those people, it affected their OPK responses, their visual vestibular ocular reflex. It also affected their vestibular ocular reflex. It made the gain high. And so that's telling you that if you've got chronic vertigo and Hashimoto's, the Hashimoto's could be contributing significantly to those symptoms. So what do you do about it? Well, I've been doing this for a long time, and anytime I have a chronic vertigo patient, doesn't matter if it's Meniere's or vestibular neuronitis or if it's BPPV, we always look at those metabolic factors, like, does the person have an autoimmune problem? Do they have a blood sugar problem? Do they have nutrient deficiencies, right? Because they matter. Even if someone's been told that they don't matter, I'm telling you that 90% of the cases that make it to me, they absolutely matter. Now, I also look at the vestibular rehab side of things when it's necessary, but we also look at the metabolic things. So what I'm telling you is if you've got chronic vertigo from one of these 3 things, whether it's neuronitis or BPPV or Meniere's, okay, and you haven't been tested for Hashimoto's, you need to be tested. Now, let me just say one thing. You don't have to have overt hypothyroidism for this to matter. You can just have the elevated antibodies and it can cause a problem, right? So you got to make sure you're working with someone that knows all of that, that can take full care of you. So can they test for the Hashimoto's? Do they know what to do if you have Hashimoto's? What if you have euthyroid Hashimoto's or subclinical Hashimoto's or overt hypothyroidism? What are they going to do about that? They're going to have to deal with your immune system, because just giving you thyroid hormones is not going to do it. So again, I have a lot of their videos on this. I could talk for 8 or 9 hours about this, but I just want you to be aware that if you've got chronic vertigo, you need to be checked for Hashimoto's. And if you have chronic vertigo and you know you have Hashimoto's, then someone needs to be dealing with the Hashimoto's, dealing with the autoimmune side of things, so that you can get better and not have to suffer anymore.